Good morning, I'm Mabel Jong, and you're watching continuing coverage of the World Healthcare Congress 2015 here in Washington, D.C. And I'm so pleased to have two gentlemen in the studio today. We have Mr. Harris Rosen, President and CEO, Rosen Hotels and Resorts, and also sitting next to him, Ashley Bacot, President, ProvInsure, a Rosen Hotels company. Good morning to you both.
Good morning.
Well, it is so exciting to be able to talk to you about healthcare because, Mr. Rosen, it seems like you know healthcare just as well as you know hotels, and you know hotels pretty well.
Yeah, that's not true, though.
Well, tell me about what you're doing on the properties of your Rosen Hotels.
Yeah. Well, it happened about 25 years ago, and we just really weren't happy with the traditional health coverage that we were receiving, working with an insurance company, and I'm sure they were doing their best, but there was something missing. I believe that healthcare was such an important issue that maybe it required ownership to really become involved. And so we made a decision. It was a rather strange decision. Many of our colleagues thought we were crazy. We said, you know, we're going to self-insure, and we created ProvInsure, a wonderful insurance company, and that became our insurance company, our own. And then we said, you know what, let's create our own on-site medical facility. And so we, at that time, were moving our accounting office out of a facility, and we said, why don't we just move in there? So we did. We hired a doctor, nurse practitioner, and a couple of administrative assistants. We purchased used equipment at 10, 15 cents on the dollar, and bingo, we had a wonderful little clinic, and we were in business. We didn't anticipate anything especially different in terms of the success, the financial impact it would have. But at the end of the year, it was amazing. Mm-hmm. We had reduced our healthcare costs per covered life, per employee, by about 50 or 60%.
Okay.
We said, well, how did we do that?
How did you do that?
We did that by really caring. We did that by being involved. Not intrusive, but involved. And then letting our folks know that health was important, wellness was important, that we wanted them to eat properly. Weight Watchers was free. We had a dietitian on staff. We encouraged people to exercise. If they came to the medical center, we would provide transportation. If they didn't have their own transportation, they stayed on the clock.
Okay.
So they weren't penalized if they would come and visit a doc. And so the end result was that we had really serendipitously created a paradigm that has served us incredibly well over the last 25 years, saving, we believe, about $240 million over that 25 years if you compare our costs per covered life with the national average.
Okay, and Ashley, I'll get to you about the actual savings, but I want to get back to the community of people that you serve, Mr. Rosen, because at your hotels, you do have a special community of employees that bring some unique ailments that we haven't seen in the United States.
Well,
I mean, can
right.
we go to that part of the story as well?
Boy, that's an excellent question. Look, at this point in time, our average age for our company is about 47, 48 years old, which is pretty old. We don't really per se have a retirement age. And so that's a disadvantage. Many companies, their average age would be in the 20s or 30s. So that's a disadvantage. Also, about a third of our associates are from third world countries,
yes,
and primarily from Haiti. We love our Haitian brothers and sisters. We love them dearly. We've been involved with Haiti for about 25 years, working on a multitude of projects. But they do come with a multitude of ailments, some of which we haven't seen in America in a long time.
That's right.
Tuberculosis is
right,
one of them.
TB.
Right.
Mm-hmm.
AIDS is another. Mm-hmm. And so that has a tendency to increase costs a bit also. But we work with our associates. Listen, as an employer, we're not allowed to even ask a question about one's physical well-being, and so we don't find out what might ail this person until we do the first physical, which is about 90 days after they are hired.
Okay, so Ashley, let's get down to the nuts and bolts of actually applying this program to your employees. Mr. Rosen has brought up that some of your employees do bring some issues, health issues, that are expensive.
Yes.
So how do you keep costs down when you're dealing with individuals have that have expensive
Well,
sicknesses?
the most important thing is just to take great care of the individual. Okay, that's first and foremost. But what we do, as Harris had just mentioned, as soon as they are eligible for our health plan, we run a battery of tests on them, a physical, labs, that sort of thing, and we find out what is wrong with them. And then we attach ourselves to them and hold their hands all along the treatment path. So that's crucial. So many people want to get well, but they get nervous in that healthcare setting and they don't go to some appointments and that sort of thing. And so we have health coaches attached to them. But another thing that keeps our folks well is we have very low barriers to care. In the traditional healthcare setting, you have $20, $30, $40 copays, you have $10,000 deductibles, and we said, how is someone going to get well if they have to worry about the financial part of it? Maybe they won't seek treatment because it might cost them something. And so we remove all of those barriers. So we have zero copays for most of our pharmaceuticals. We have $5 copay to see the primary care provider. We struck a deal with Walmart where almost all of our associates pay zero for their pharmaceutical copays. Sometimes transportation is a factor in preventing folks from getting good health care, and so we provide transportation to those that don't have transportation. So it's removing those barriers that have helped to make us so successful.
And our folks stay on the clock. So we don't ask them to punch out if they're going to the facility. They stay on the clock. So they're paid.
So they're paid for their
That's
time
right.
off.
Absolutely.
Site.
Because they may be in the facility for an hour, if a multitude of tests, and we didn't want them to be deprived of their pay.
Well, it certainly sounds great for the patient, the customer, the consumer.
Right.
But how do you do it? Because let's get down to really how you are able to pay for their transportation or pay all of their, or not demand copays for their pharmaceutical items that they might need for their medicines. How do you do it? That's what the sector is going to want to know. That's what healthcare, the rest of the healthcare organizations want to know.
Yeah, and it's not rocket science, really. It might sound overly simplistic, but it's just really caring. It's really scotch taping yourself in a non-intrusive way to our associates and telling them we love you. We want you to be healthy. We don't want you to smoke, so no smoking. If you smoke, you could be in trouble. And we do random drug tests. We look for nicotine, we look for alcohol, we look for illegal drugs. And so we want to encourage our folks, please try to stay as healthy as you can. We have in our medical facility a fitness component, and we have a director of fitness, and we do acupuncture, and we do mammograms, and we have a radiology department there, and so it's so incredibly convenient. We even have a little pharmacy there, so we let our folks know that we really care a great deal about them, and that concern and that care helps to keep them healthy. When we keep them healthy, they're not going to specialists, they're not going to the hospital, and that's how we reduce costs. Keep someone healthy, keep them out of the hospital.
So you're encouraging and really putting in place programs to really encourage healthy behavior.
Right.
Do you have anything that is similar to what we're trying to achieve in the rest of healthcare in the United States, payment reform or all of that? Or no, because you've established a system where you don't need to reform anything, you just printed it out right when you started?
Well, as it relates to payment reform, I mean, the theme of it, as I see it, is going from this fee-for-service system, right, to paying doctors to really fix people.
For episodes of care.
Absolutely. And so we have, it's not rocket science. We have a good model for fixing folks, and that is, number one, find out what's wrong with them. That's the first thing you need to do. And as soon as we find out what's wrong with them, we design a treatment path and we keep them on that path. Our costs are 40% less than what others our peers are out there. So we spent about $25 million on healthcare last year. Had we been in the traditional setting, it would have been closer to about $45 million.
What would your advice be to other organizations that want to create what Rosen Care has created for its employees? How do you start?
Well, listen, that's a great question, and Ashley certainly is available to help provide guidance and wonderful comments about how one might be able to start. You do need a certain number of employees or covered lives, and that would require about 1,000 covered lives, I guess. And there are small businesses that have 5, 10, 15, 20, 30. And what we would recommend is that they get together, talk to each other, and then rent a storefront. And hire a primary care doc and a nurse practitioner and some administrative assistants, and bingo, you're there. Look, primary care is the earliest opportunity that we have as an organization to find out what's wrong with someone. Once we do that, as Ashley says, then we can continue the process. But primary care is really critical. So others can replicate the program, and what we've done is we've crunched some numbers. So if there are 140 million people who are working, and they all had the same results that we have, where our cost per covered life is X, and the cost per covered life nationwide is maybe 2X, the country as a whole would save hundreds and hundreds of billions of dollars.
So are you suggesting that all companies in the United States could replicate what you do?
Well, we certainly would hope that it would be an alternative. I mean, you have ACA, and I suspect it's going to be there for a while, and unless the Supreme Court finds that the subsidies for the federal grants are inappropriate. But this would be a wonderful alternative, and offer the employer and the employee a tax credit for contemplating their own healthcare process. And see, employers want to establish a closer relationship with their associates. They want the associate to know that we care, and we really do care. And so if you separate a very important benefit from the employer's realm, I think you're doing the employer and the employee a disservice.
Mm-hmm. What is your message to the folks here at the conference? Each year we seem to have a different theme for the issues that people are talking about. This year it seems really focused on the consumer, how to engage people in their health. It seems like you've already done all of that at Rosen Care. So what do you suggest people keep focused on when they start going back to their organizations after this meeting and want to start putting strategies in place, aside from you have to care? Is there something a little bit more specific than that?
I think employers need to, and their employees really need to get engaged in changing the healthcare paradigm. You know, we are the employees are the patients. Okay, it's up to the employee to say, I don't like paying these high deductibles now. I don't like paying these co-pays. I can't afford this, I can't afford that. I can't afford to be put at risk for bankruptcy if I can't, pay my doctor's bill. And I think if the employees and the employers band together and shout out loud to the healthcare world, we're not going to take it anymore. We want to do it this way. We want to do it that Rosen way. I think we'll be well on our way to making people much healthier and saving a lot of money for our economy.
Look, it is a bit scary. I mean, when we started doing it, people said we're crazy, and we had our concerns. I mean, how dare you enter into a realm that you really don't know anything about? But now we've been doing it for 25 years, and we've learned some stuff, and others have come and visited us and have gotten excited about maybe replicating the program. We can help. So let's say someone hears about Rosen Care, and they say, gee, I've got about 1,200 associates, and I'd like to try it. They come over, they talk to Ashley, they take a look at our facility, and they learn, they learn not to be afraid, not to be apprehensive, but that this is a possibility. And when you look at $240 million over 25 years, I mean, that's a pretty nice savings. And smaller companies might save, well, we $5 million or $10 million or $1 million. That's really important. But the most important component is you are creating even a closer relationship with your associates. And that's what's so important.
All right, Harris Rosen, Ashley Bacot, thank you so much for your time today.
Thank you.
Thank you, Mabel.
And I'm Mabel Jong. Thanks for watching.